This is a very common question and concern of patients considering breast augmentation. Will breast augmentation, the silicone implants, increase their chances of having breast cancer? Okay. Of course, as doctors, we are very, very careful if it does or it does not. And there are several studies saying that it does. There were several studies, equal amounts of studies saying it does not. Okay. And then US FDA did a 10-year study from 1994 to 2004, investigating whether breast implants would cause or increase the risk of having breast cancer. Okay, so what did they do? They reviewed patients who had implants since 1970s, who had some breast surgery, and they examined the implant. They compared the chances of these women of having breast cancer to the general population of women who didn't have any breast implants. Okay, during this 10-year study, they also actually regulated the use of implants in the U.S. and its territories. Okay, if you are a virgin case, first time you have a breast augmentation, the doctor is allowed only to use a silicone implant with water inside. Okay, just we call that the saline-filled implants. Okay. This is a saline-filled implant. Okay, it's made of a silicone bag with salt water inside. Of course, the water is gone; only the salt is there. Okay, a typical implant is a shell, silicone shell, with actually silicone gel inside. Okay, and the concern of patients is that if the shell or the bag ruptures, the gel will go out. Okay, and then it might cause breast cancer. Okay, so US FDA studied and accumulated the data. As early as 2002, they have accumulated so much data that they release actually their findings. Their findings was that having breast cancer or ruptured breast cancer does not increase or decrease their chances of having breast cancer. Okay, being a woman, your chances of having breast cancer is there. Okay, the breast implant will not increase that. So, for patients who have breast implants already, okay, you still have to do your regular mammogram, and WHO, World Health Organization, will actually advise you to have one at least every 2 or 3 years when you reach 35 and older. If you have a family history of breast cancer, you have to do it yearly if possible. Okay, now, is there an age limit with regards to breast augmentation? Okay, for us, as long as you have reached the 80% of your growth potential physically. Okay, so in women, this is usually after 18 years old or older. Okay, we have also legal implications. 18 years old, younger than 18 years old, you have to get the consent of your guardian or parents before we can do the surgery. So that's it. But actually, 18 years old and above, sometimes 17 years old, if the parents would give the consent, we can always do the breast augmentation already. Okay, will breast augmentation affect pregnancy or giving birth? Okay, actually no. If you have a breast implant and you get pregnant or you plan to have pregnancy, okay, you don't have to remove the implant at all. Your breast will behave just like as if there was no implant. Breast will be affected by hormonal changes. It will become enlarged when milk is produced, and you can breastfeed safely. You don't have to remove the implant if you do that. Okay. Now, so if you're wondering whether you need to have children first before you consider breast augmentation, that's not an essential thing to do. Okay, you can have it while you still don't have children, and you can have it even when you have kids. Okay. Breast augmentation is actually enlarging the size of the breast, but very few patients know or understand that enlarging the breast would also lift the breast up. Okay, because the breast sags because of two reasons. One, the skin envelope is actually increased during pregnancy. The breast becomes engorged, the breast becomes bigger. When after breastfeeding, the breast becomes smaller, so If the breast skin doesn't have elasticity, it would sag. Okay, so what do you do? You increase the size of the breast with implants, and that would lift it up as well. So it makes it larger and lift it up as well. However, if the sag is moderate to severe, okay, if the level of the nipple areola is below the inframammary fold, putting an implant there or augmentation alone might not lift it up to the satisfaction of the patient. Okay, usually we can do both: increase the size and at the same time reduce the skin envelope to lift the breast up. So that is called augmentation mastopexy. The most important thing that the surgeon has to determine is what is the appropriate size for a particular patient. No? Here in New Life, we maintain that the doctor only suggests the size. It's still the patient who selects what they really want, okay? And most patients are shy, doc, I don't want it really big, but basically, what is big for a particular patient? What is natural for a particular patient? That's very vague, okay? So we used to have a software which you input the size of the implant, the chest dimensions of the patient, the brand of the implant, and let the patient put on a virtual goggle. And then when the patient looks through a virtual image, she sees herself with that size of implant on front, and then when he looks at the side, he sees herself in a side view. So again, but that is just a virtual image, no? So we stopped using that because it doesn't help so much, okay? It impresses the patient, but it doesn't help really. What we have are sizers, okay? These are, can I have some sizers, please? Okay, sizers are actually silicone that are shaped like a breast, okay? These are silicone material also, but these are not implants. Now they're shaped like a breast, okay? From very small to larger ones, okay? There you go. We'll let the patient try the smallest one and put it underneath the bra, okay? Just like this one. And then we ask the patient to look at the mirror, front view and side view, okay? And then we tell the patient, now put the next bigger implant on the other side. So we always ask the patient, which side do you like more? And the patient will say, okay, I like the bigger one. And then we remove the smaller one, put it until the bigger implants, or the bigger sizes, until they would say, doc, that's too big for me. So basically the patients get exactly what they want. Because this sizer, for example, this is sizer number 4, okay, has a corresponding size of breast implant, okay. Number 4 actually would correspond to about 360 cc implants, okay. So that's the best way that the patient can decide for herself what is the appropriate size of the implant, okay. So will sensation or feeling of the breast change with breast augmentation? Okay, yes and no. Yes, because it depends on the approach. If you cut through the periareolar around the nipple, there's a 0.8 chance of injuring the nerve to the nipple. So sensation will decrease or even get lost. Once that happens, that's permanent. So me, as much as possible, I try not to approach it here. I approach it through the armpit. Because you create a tunnel, a pocket for the implant, okay, underneath the muscle, underneath the breast. The breast is never touched at all, okay. So in some patients, okay, if they experience changes in sensation and the approach is not through areola, okay, we tell the patient just don't worry about it, because more often than not, in about a month or 2, your normal sensation and feel of the breast and the nipple will return. So after the breast augmentation, patients are actually encouraged to be up and about as soon as you can, okay? We ask them to massage the implant as soon as they can tolerate by pushing it against their chest wall, okay, for 1 minute, 1 minute. Okay, now, of course, patients are scared. They always think that movement will displace the implant. that squeezing it will actually make the implant leak or burst. Okay, so the purpose of the massage and early activity is to restore the patient's confidence as soon as possible, so that no matter how much they get physically active, okay, the implants will stay there. Okay, just like in any other surgery, the sooner the patient gets out of bed, goes back to physical activities, the faster the healing will be. So the rule is, after the surgery, okay, try to get out of bed, try to do your usual physical activities, play it by ear. If it's not painful or uncomfortable, do it. Okay, because the sooner you move, the faster you heal. After breast augmentation, okay, again, we encourage the patients to be up and about. Okay, since the breast can be covered by clothing, movement is restricted but not forbidden. Okay, going back to work is actually encouraged. Office work, of course, definitely you can do that the following day or after 2-3 days. Okay, driving will be a little painful, but again, it might be painful only the first day. So going back to work depends on the kind of work that you do. Is encouraged as soon as possible. Will the implants affect how the physical activities of the patients, what they can do and what they cannot do? Okay, we are doctors. No? It's not only with breast augmentation, but with other procedures. Okay, there are 3 criteria that has to be met before we do a certain procedure. First criterion, it should not affect the function. Here, the breast should not affect breastfeeding or touching the breast. Okay, anything that is considered a function of the breast should not be affected at all. Okay, second criterion, okay, lifestyle should not change. Okay, it's not true that you're not supposed to be physically active, that you're not supposed to squeeze on the breast or put pressure on it. So I have patients who go scuba diving, and I allow them to do that after 2 weeks or a month if they're confident enough. So, and engage in contact sports. Okay, so again, it should not affect the function of the patient at all. This is a very common question. Can I breastfeed after breast augmentation? Of course, yes, you can. Okay, of course, let the surgery heal. And then when you can get pregnant, you don't have to remove the implant. The common concern of the patient is that silicone might go into the milk and might be harmful to the baby. Of course, it doesn't do that. The silicone inside stays inside the pocket. If it ruptures, the pocket contains the implant. It does not go out. Okay, so it's safe to breastfeed the baby. Of course, we are the surgeons of the stars and the scars. Okay, so we try to do the breast augmentation with the least possible scars. And for me, again, I consider the wishes of the patient. I had one patient. I usually do it through the armpit. In the armpit, we have like crease lines there. Crease lines are folds. Okay, we can hide the incision there, and it will look like a crease line. So it's not true that when you do it through the armpit, okay, you cannot raise your arms anymore, you cannot wear sleeveless. The scar will look like a crease line, okay, so it's normal. Of course, it takes a little bit of a few months before it turns into almost invisible, okay. Now, there are some patients who don't have lines. Doc, I am very, very particular with my armpit. No line at all, nothing there, so I want it. The next best is, of course, periareolar. Of course, as I said, 0.8 chance of injuring the nerve to the nipple, but it produces a good scar. And the third approach would be inframammary. Okay, so among the 3 approaches, the least visible will be the armpit one. Okay, so now if you had breast surgery before and the scars are not acceptable to you, there's always a chance to revise it. No? We call it scar revision. We convert the scar into a thinner line, a finer line, so that it won't be seen, or hide it in the natural fold. Okay, so it doesn't mean that when you have scars you don't like, that's there forever. Sometimes or oftentimes it can be corrected as well.